The recent detection of human metapneumovirus or HMPV cases across Bengaluru, Gujarat, Tamil Nadu, and other states has prompted both state and central government to issue alerts. As concerns grow and questions arise about this virus, many are seeking clarity on what HMPV is and how it can affect us. Today, we aim to provide that clarity. Welcome and namaskara to the Hindu Business Line podcast, where we explore key issues with industry experts. I'm your host, Aishwarya Kumar, and joining us today is Dr. Suraj Jain, Clinical Operations Head at the Manipal TRUtest. Dr. Jain, thank you for being with us here today. Now, just to start with, can you please help me understand what the HMPV virus is and how is it different from other respiratory viruses like the flu?
Thank you very much, Aishwarya and the team of Hindu Business Line. So, coming to your question, now HMPV virus, as it is, you rightly said, human metapneumovirus. It's a virus which has been, it's a virus which belongs to a group of viruses called paramyxoviruses, to which the other viruses, including mumps, Nipah virus, also belong to the same family. So, and it's a virus which has been here for decades. It was first detected in 2001 in Netherlands, and followed by in India, it was detected in 2003. So this virus is not a new virus. It has been in the environment and it has been there for the last 2-3 decades, and it is very closely related to this paramyxovirus group of virus.
Right. So, how did this virus come into existence? For example, we know that COVID-19 came from bats, and that's from bats how it came to human beings. Do we know the origin of HMPV as of now?
Yes, we do have. As I said, the virus has been in existence for the last 2 decades, and there have been studies which have been conducted when it was first detected in Netherlands. They have conducted studies and they have found that this virus was quite prevalent even before also. And as it is group of respiratory viruses which typically causes all this upper respiratory infections and this thing. And if you look at, if you're drawing parallels to the COVID virus, when we are curious to know about the origins, when studies have been conducted on this, they have found out that there is a group of virus called avian metapneumovirus, which is the typical virus that infects the birds. So they have found structural, the genes and everything which is similar to this, and so by this we can conclude that there could have been a zoonotic transfer, that is transfer from birds to humans. And I mean, this is a fair idea how we can talk about its origins. Like, so it could be a zoonotic transfer from birds to humans, but right now it is like the virus which spreads in humans itself.
Okay, sir. What are some of the most common symptoms of HMPV infection, sir?
See, HMPV virus causes a typical the upper respiratory infection, a typical influenza-like illness, when we call it as, where you will have running nose, you will have nasal congestion, you will have sneezing, and there will be sore throat. So just like any other respiratory infection, so these will be the symptoms, and it can extend to, like, people can have cough, wheeze. Most of these infections are mild. I mean, they just resolve in 10 to 15 days, and people completely recover within this 10 to 15-day period.
Right. And is it how is it transferred from person to person? Like, is it airborne or spread through direct contact?
Coming to like the spread of virus, it is we can draw parallels to like how the COVID virus used to spread. Of course, one thing is it is less contagious compared to the COVID virus. And again, the transfer is through airborne, that is through respiratory droplets. And also, this virus is known to survive on surfaces for very short periods. So that explains why we have to follow the hand hygiene. So, but it is quite, not just quite, I mean, very less contagious compared to the typical experience that we had during COVID.
Okay. And so, who are at the higher risk of developing severe complications for HMPV? I've read few instances where, babies or infants and maybe the elderly ones who have compromised
Correct.
immunity who are at a higher risk. Maybe if you could delve deeper into this.
Yes, yeah, as you rightly said, this, I mean, the virus do infects each and every one. It can affect anyone, adults or extreme age groups. But the ones which are at higher risk group is definitely the children who are less than 5 years of age, and then elderly like more than 60 years of age. And these extremes of age groups, because of uh, I mean, you would say like the immune responses are little not full. I mean, in children it is not fully developed, whereas in elderly the immune responses starts to come down. And when we talk about real risk groups, it is the people who have comorbidities, who have underlying conditions like diabetes and other chronic conditions, and the people who are having I mean, underlying respiratory diseases like asthma and this broncho I mean, asthma and other conditions like that. And when we talk about immunocompromised states, so this could be a group of individuals who are who are undergoing chemotherapy, who are like post transplant individuals who are like immunodeficient either due to HIV infection, or they could be like immunodeficient by birth, which we call it as immunodeficiency conditions. So these are all group of high risk individuals who will have severe symptoms. But when you talk about this virus, in most of the individuals, like almost everybody, the only about like 1% of the individuals will have symptoms. I mean, those who are infected, only 1% will have symptoms which we had described. And
Okay.
and the mortality is almost nil. I mean, and mortality can be seen only in these risk age groups which we had, high risk group which we had discussed about. And in this immunocompromised or risk age group, the mortality can be anywhere between 10 to 80%. That is like different studies depending on which risk group you are talking about, the mortality can vary in them.
Right, Dr. Jain. Also, if you could just help me understand what is the incubation period of HMPV and how long does it take to recover completely from the virus?
Incubation period, just like any other the respiratory group of viruses, it is just 3 to 6 days. And during this period, they will not have any symptoms. The very fact
Okay.
incubation period means the virus is just entered your body and it is growing,
Right.
or it is replicating to an extent that it will produce a clinical condition. So this period, I mean, there won't be any symptoms, and this period is almost about 3 to 6 days, and after which many of them the body defense mechanisms tries to limit the disease, and there won't be any symptoms. Very few individuals, as the risk group we spoke about, where the immune defense mechanisms are weakened due to various reasons, only they may start showing symptoms. And even if they start showing symptoms, these all recover, most of them recover within 10 to 15 days.
Okay. Mr. Jain, how maybe if you could help us understand and our listeners understand how to prevent the spread of HMPV, especially in households with young children and elderly individuals. Also, are
Correct.
there any vaccines available for HMPV, and or are there any in development that
Mhm.
we know?
Yes. Now coming to how do we limit the I mean, those who are infected, what precautions we can take. So I would say like those who are infected and those who are sick. By saying sick, I mean those who are exhibiting symptoms. They can just stay home and avoid contact with any other individuals, because they are already showing symptoms, and that is the best thing they can do. And whenever they are like they can or when they are in the contact or in middle of the individuals at home, they can cover their mouth or nose with a handkerchief or a mask while coughing or sneezing. And when they stay at home, they need to stay hydrated and take nutritious food. And as I said, they are definitely going to recover in 10 to 15 days. The ones who are not infected, they have to avoid crowded places, because the crowded places are the areas where rate of infection can be higher. So to limit that exposure, avoid the crowd places. And even if you happen to visit crowd places or like public spaces, you use mask. And the most important thing, whether you are sick or you are like completely normal, the hand hygiene, which we emphasize more upon. you should wash your hands regularly with soap and water, and minimum of 20 seconds. And or you can as you I mean, if this is not available at certain places, you can as well use a alcohol based sanitizer. And these are the precautions that we can take, but there are certain other things which we should avoid. I mean, we should be careful about, like if a sick individual is at home, you should not use or share this I mean the share their towels or any other belongings that they're using it, not to share them. And you should not even frequently keep touching your face, and especially areas like eyes, mouth and nose. And that's how you can limit exposure, this thing. And coming to second part of your question, whether there is any vaccine for this. So as I told, this virus is definitely very less contagious, and it is not at all I mean, in terms of mortality or in terms of the rate of infection. Like as I said, out of 100 people, only one or two persons are the ones who will show symptoms. So
Right.
in view of this low infection and low mortality rate, at present there is no vaccine which has been developed. And if we go back to COVID era, I mean that had a higher contagious. It was highly contagious. It had a higher mortality, and which necessitated, and it even reached, because of its spread, it reached the epidemic and pandemic proportions. So we had to develop vaccines there. So here, looking at the impact that we see with this HMPV virus, which as we have told that this has been in nature. I mean, this has been there for the
Right.
last 2 decades. Only that
Right.
no. Usually, what happens is that anything which has its links with China, like the moment the news started spreading from China, so the they're just very people get anxious about it. And which is more, we can say, like the heightened awareness that we had post COVID era. So at present there are no vaccines, and I don't see that there will be any requirement for it.
Right. Dr. Jain, is there anything that you feel you should add on to our listeners?
No, I would just say that, see, just, I mean, as I already told, that this virus is a typical respiratory group of viruses, which, as well, you can say it is like the influenza group of viruses, which it's a flu-like, it will cause a flu-like illness. And this is there, and this virus usually spikes in the winter months. So, and the reason for the same is, like what happens in winter, we have a very dry and cold weather, and our we have a natural defense mechanisms in our nose. We have a mucus in the airways. We have mucus, and so this mucus tends to get dry and in cold weathers, and it decreases in quantity. So this reduces the natural barrier, and that is the reason why not just this HMP virus, but all these flu-like illnesses are more in these months. So it's just like any other like respiratory virus, and just that now, and as I told, at least COVID was something which was new, and it was an immediate transfer from a zoonotic group to the human this thing, and the our immune systems were not prepared for it. So that was a totally different scenario. But coming to HMPV, it has been there, and there have been studies which even say that, like if you happen to do any serological study in like in the population, almost 90% will have already antibodies against they, that means to say they have already been infected with HMPV. So now that just few cases, I mean, it started from China and the news flow that come from that region. So it's just adding to that. I mean, why there is so much of hype around this virus. But it is definitely to say it is this virus. I mean, I would just try to summarize that this virus is not new. It is
Okay.
not deadly.
Okay.
Definitely not deadly. And
Right.
and this is not going to reach any epidemic or pandemic proportions.
Thank you, Dr. Jain, for shedding light on human metapneumovirus and helping us navigate how to navigate these uncertain times. Your insights have been invaluable in demystifying the virus and offering practical advice on prevention and care. To our listeners, we hope this conversation has been informative and reassuring. Remember, staying informed and taking preventive measures are key to safeguarding your health. Panic is definitely not the way. Thank you for tuning in to the Hindu Business Line podcast. Stay safe, take care, and we'll catch you in the next episode.